You're watching Utah's #1 news channel. This is 2 News at Noon.
Okay, it is October 1st, and we have a nice sunny day over the Salt Lake Valley. Things will be changing, getting a little cooler. We will have Jill along with the forecast in just a minute. Now, October 1st, it means the kickoff to Breast Cancer Awareness Month, and we have the breast cancer specialist, Dr. Brett Parkinson, here with me. He's my breast friend.
And you're my breast friend.
The doctor who diagnosed me. And but you're here talking about 3D technology, this new 3D tomosynthesis, right?
Right. It is basically 3D mammography. What we find with mammography is that when we use two-dimensional mammography, which has been the workhorse for breast imaging, we miss certain things. It's not as sensitive as we'd like it to be because there's overlapping breast tissue, and sometimes we have to call women back and do additional tests.
And it's scary.
And it's scary.
Yeah.
With 3D mammography, we actually can see more because we see individual slices of the breast. If you have a 5-centimeter breast, we're able to see 50 different slices, almost like a CT scan.
Or like an MRI.
Yeah, it's like an MRI. Because,
but a lot less time.
It only adds 4 seconds to each compression, and it is minimal additional cost, and the cancer detection rate is much higher than with traditional 2D mammography, and we call fewer women back for extra views. So it's a win-win situation for all of us.
Do you still have to do a biopsy?
We'd still have to do a biopsy if we see something suspicious, and we still do 2D mammography, so we combine them. We do 2D and 3D because you need them both, because 3D is not so good for calcium deposits, but it really has increased the pickup rate for breast cancer by 40% in some studies. So this is significant.
In my last checkup, I had the regular mammogram, the 2D, and the 3D, and honestly, it was exactly, you're in the same room, same machine, they just use a different technology. Right. And it gives you like a live image, practically, of the whole, all the tissue.
And I think you and I went over the images, and you saw how we were able to go slice by slice, uncovering things that may have presented as overlapping tissue. So it really is an additional help to the radiologist.
Okay, and is this paid for by insurance companies? Are we working on that?
We are working on that, but a lot of places are not charging additional funds for that, but the incremental cost of that is only between anywhere from $20 to $50, whereas if you have an automated whole breast ultrasound for screening or an MRI, can run into the hundreds, and with MRI, the thousands of dollars. So this really is a good thing for women.
Okay, and another good thing for women is October, Breast Cancer Awareness Month. Make sure you schedule your mammogram. Just go, right?
Just come in, and we will see as many women as we can this month and every month.
Get it done. Okay, Jill, over to you.
Good, yes. We always love the more information we know for women, the better. Okay.